Afternoon. Thanks for joining us for our conversation today. I'm going to begin by just very quickly sharing with you a few observations from the work that we've been doing in the integrated program over the last 4 or 5 months, and just some general themes before we get into sort of more specific discussion. 1.5 billion children worldwide have had experienced major disruptions in sort of their everyday activities and things that they do. Many parents are very busy keeping children at home while they're working. Many parents, particularly those who are dealing with their own sorts of health or mental health issues, may not be extremely well equipped to deal with the stress of this. So family functioning is an important consideration. And we're all living in a time with increased stress and media hype, uncertainty and fear. And for those of us that are living in crowded households or experiencing major financial hardship, these challenges are all exacerbated. Evidence shows that child abuse increases for children during periods of school closures. One thing to note that's important in sort of family functioning, individual and developmental differences exist in terms of risk tolerance, which may create specific tensions within families, particularly families where the developmental sort of imperative for teens, young adults, is to really be out in the world, experiencing that in a full way. Those of us that are healthcare workers or those that have essential jobs certainly experience a greater sense of fear and stress around this pandemic. And for many, the economic consequences of the crisis increase the problems that we're facing. In terms of the effect on children and adolescents, just again, very high level, all of us as mental health professionals are dealing with a lot of kids of various ages with pre-existing conditions. Depending on what the nature of the conditions are. Some may have gotten worse, been exacerbated during the pandemic. Some may have gotten better. Children and adolescents who are more prone to risk-taking behavior may be at greater risk for not following guidelines and acquiring infection. Again, social distancing and isolation are really very much against what the sort of imperatives are for adolescents and young adults. And certainly substances, if we consider the use of substances, many adolescents, given the stress and emotions of the moment, may be at greater risk for abusing substances. And those that are regular users of substances already may experience withdrawal or not have access to the usual substances they use, and may, as a result, find their way to more dangerous substances. I just want to highlight a few things that we know from the research. These are not, this is not what I would say is rocket science. These are all pretty obvious, but things that we want to keep in mind as we think about this topic of child and family mental health. It's clear to all of us, I think, at this point, how media can escalate anxiety, and social media more than traditional medias. Obviously, the amount of screen time kids are having now and consuming media can contribute in many ways to their health or mental health. Certainly having access to trustworthy information is important for people that are coping with risk. And in the world we are in today, the lack of certainty we have about some of the information sources we're exposed to, or at times purposeful distortions of information, can increase stress and discomfort for people. Obviously, in the midst of this, we're all feeling a peculiar lack of control, and we all know very well that relationship to stress. Obviously, managing stress and any of the other mental health sort of exacerbations that are come along with the pandemic, the sooner we can help kids and families with these, the better they're going to function, and we may be able to prevent long-term difficulties. And there's just a large number of ways that quarantines and isolation can increase negative outcomes for children and families. And we'll talk a little bit later, I'm sure, about the ways that we can reduce the risk of negative mental health outcomes. With that said, I would like to turn to each of our panelists and ask them in turn to tell you a little bit individually about the clinical context that they work in, and to highlight what they see as the key pandemic-related child and family mental health issues. So I'm going to begin with Michelle, if you would like to tell us a little bit about the context you're working in and what you see the key issues as.
Thank you for that great introduction. So good afternoon. My name is Michelle McCallion. I am a vice president at Behavioral Health Network, which is a pretty large mental health organization serving Western Massachusetts. I oversee our children and family community-based programs, which means we have different levels of children's behavioral health initiative programs. We offer all of those. I oversee our early intervention programs, our ABA programs. We also have multiple multiple grant-funded programs, and so the level of interventions that we're able to provide are at various levels, and we serve birth up through age 21 for youth, but we also serve families and adults in our other programs. So that being said, we certainly are noticing significant impacts of the current crisis on the functioning of families and youth, and in our workers as well. And I'm just glad that Jonas brought that up. I'm going to share my screen a little bit just so I can share with you some of the information that we have started to gather. So we as an organization have started to gather some qualitative and quantitative data. As you know, it is still pretty early on in the crisis, and so I'm going to share some of the, not quite the numbers yet, we don't have a lot of that, but some anecdotal and qualitative information that we found. Some of this might be a little bit repetitive. I will go through this quickly, and so please feel free to save some questions. I'm happy to answer them later on. So what we're seeing right now is significant amounts of anxiety and stress. And I would say that was the most prominent concern that we noticed right from early on. There's a high degree of uncertainty and fear associated with the pandemic. And as Jonas mentioned, all of the things that are associated with that. The stress of being home and together all the time, children without siblings are experiencing higher levels of loneliness. Multiple children and families are fighting more often, and parents are really trying to engage their kids full time and are having challenges finding ways to do that. There's significant conflict experienced in families. Parents aren't really able to take the breaks or the time off that they normally would, and they can't access their natural supports as they normally would. And so parental stress is really high, which then of course increases youth anxiety. There's significant economic stressors that Jonas mentioned, so I won't get into that, but that is a huge factor. So for youth, we're also seeing separation anxiety significantly increasing. So we've had lots of stories, parents even saying they're going out to get the mail and the child is worried that, the parent's not going to come back even from that short stint down the driveway or, down the stairs in the building. And depending on developmental age, youth are understanding this at very different levels. They don't know how to express their confusion, fear, uncertainty. They're worried about the virus. They're worried about getting sick. They're worried about their families getting sick. And younger children especially don't understand what's happening and why it's happening. They see their parents stressed and anxious, and they don't know how to manage their parents' feelings along with their own. We're also seeing, and I'm hearing a lot about regression, so in the emotional, developmental, and educational realm. So youth, who are, at normal developmental levels, are certainly, reverting back to old behaviors. And then, of course, we see that with youth who are already kind of behind in their developmental milestones, we're seeing an even more significant regression. We know the effects of anxiety are pervasive, emotional, mental, physical, and these are certainly exacerbated at this time. With education, as Jonas mentioned, homeschooling, parents have multiple stressors. They're unable to create structure and support that would allow their children to be successful in homeschooling. Youth with challenges pre-COVID are now falling further behind. Kids are not practicing and learning basic skills at the same intensity, and individual support from teachers is very limited. And so those normal developmental educational milestones aren't happening along with the social development. Kids are missing out on normal social interactions with peers that we know is critical to their normal development. And we probably won't know the long-term effects for some time until we gather more data. Technology also changes social interaction, as Jonas mentioned. Research is certainly varied on how this affects children, but again, we won't know the impact of or how long this is going to last until we have some time to gather data. Extracurricular activities are not available, which are normal outlets for stress, and families are struggling to find other avenues. One thing really important to note, so for youth who receive early intervention or applied behavior analysis services, are missing out on critical interventions during window of opportunity. So there are youth who are getting speech and language, say, either through ABA or through early intervention. If they're not getting it at those critical moments, this could have long-term ramifications for autistic, developmentally delayed, or physically challenged youth. Again, we're seeing, because of the levels of stress and anxiety, we're seeing an increase of youth and families in crisis. We're seeing significant increases in crisis placements, so inpatient levels of care in community placements. We can't conduct the same level of family work that will allow kids to transition back to the home. And more parents are opting not to take their kids back home when they normally would, because they're really anxious to do so without support and aren't feeling that the crisis was addressed. Kids are also getting stuck in placements at this point because programs are not taking new admissions. Our community-based acute treatment program has historically operated at 1/3 to half capacity in the summer. And we're seeing really historically high census rates at this point, where there's still a waiting list in the summer for kids to get in. Other stressors, we know that COVID affects poorer populations in higher numbers. And so families that are already at significant disadvantages are now suffering higher rates of infections. So families are dealing with other family members being ill. They're unable to visit them in hospitals or nursing homes to support their loved ones. And family members are actually dying, and they can't mourn as they normally would. So they can't engage in their normal traditional cultural rituals. The ability to gather is very limited. And so this also leads to feelings of social isolation that can contribute to depression and mental health symptoms. And then we're also experiencing systemic challenges, as many of you will probably be able to relate to. So schools, daycares, programs, as Jonas mentioned, we're not seeing youth in person, and therefore we're missing signs of child abuse. Programs are not reporting suspected child abuse, and DCF is really almost eliminated visits to homes except in cases of emergencies. And so we're missing out on a large portion of the population that needs support. And then domestic violence is also not being reported at the individual level, and shelters are not at capacity. So there's less of an outlet for folks. So there's a real danger at this point for, it's not just the danger of the mental health impact, but physical danger to children and families as well. And then very quickly, we had to move very, very quickly to a telehealth model in all of our outreach programs, including our early intervention, including the programs that deliver OT, PT services. And so it's working a lot on some levels with lots of ingenuity and willingness to engage on the family's part, but it's really difficult for parents to engage in their own therapy when their children are in the same space. Workers are also unable to assess home environments as they normally would. So we're unable to help parents facilitate or give structure to interventions that we may suggest. There's also a high level of Zoom fatigue. So parents in families who have multiple children with services, and then the parent is getting their own services. Being on Zoom all day, which I'm sure many of you can relate to, can be very fatiguing. And so parents are starting to disengage a little bit from particular services that they normally would engage in. Of course, technology isn't always reliable or available to families, and so we've had to work very hard to get families access to the services that they need. But as we know, technology certainly isn't always the most reliable method. So that's so far some of the information that we've gathered, and it was very quick. So I'm happy to take questions after the other panelists have gone. Thank you.
Thank you very much, Michelle. Patricia, can we turn to you next?
You absolutely can. Hi, everybody. I'm Patricia Beziaco. I am the Associate Chief of Clinical Services in Psychiatry here at Boston Children's. And the clinical services that we have span from the emergency psychiatry service, the consultation liaison service that sees patients on the inpatient medical and surgical floors, our inpatient psychiatry service, a community-based acute treatment program, our outpatient services, and school-based programs. But before I get into the specifics of what Boston Children's may be doing with regards to the mental health of kids, I want to take a step back and just share some information about what we can expect from literature and research about the impacts of COVID on the mental health of the general population, and B, of children and adolescents in particular. And it can be broadly divided into like the economic effects, and then the effects of the lockdown, and the effects of COVID itself. Regarding the economy, during the Great Recession, 2008, there was a 5 percentage point increase in national, for every 5 percentage point increase in national unemployment rate, there was a 50% increase in clinically meaningful childhood mental health problems. So during this pandemic, unemployment exceeded 11% in January. So we anticipate that with that will come significant impacts on children's mental health. And other countries who started to experience the effects of the pandemic before us started to write about it. So in China, there was a study that came out of the province where it all originated. And after about 1 month of being locked down, they examined a group of over 2,000 school children for signs of emotional distress. And about 23% of them reported depressive symptoms, and 19% were experiencing anxiety. And then in the United Kingdom, their lockdown started in March of 2020. And they did a study in April of 2020, 1 month into their lockdown. And the population prevalence of clinically significant levels of mental distress rose from 19% in 2018, pre-pandemic, to close to 30% in April 2020. And what they found in the UK was being young, being a woman, living with children, and specifically living with preschool age children had a particularly strong influence on the extent to which mental distress increased under the conditions of the pandemic. And then here in the US, JAMA also published in April a study that was done and comparing the psychological distress and loneliness among US adults age 18 to 24, and they found significant increases, especially in women. And there's even more. There is something called the Say Something Anonymous Reporting System, and that is where people go and they give tips about serious suicide. And they saw an increase from 7% before COVID to 18% of tips of serious suicide happening. Now, when you think about all these numbers and percentages, it might not sound so impressive. So let's do them in numbers. Mental Health America is an organization that has been conducting online screenings for 6 years. And to date, they've done over 5 million screenings. And so they're the largest screening program of its kind in the United States. Since the start of the COVID-19 pandemic, they have noticed a dramatic increase in depression, anxiety, psychosis, and suicidality. As of the end of June, almost 170,000 additional participants reported having moderate to severe depression or anxiety compared to participants who completed the screen prior to the pandemic. And this is all just the short-term impact. What can we anticipate in the long term? JCAP is the journal of the American Academy of Child and Adolescent Psychiatry. And in June of 2020, they published a study that drew on over 60 pre-existing peer-reviewed studies on topics about isolation, loneliness, and mental health for young people aged 4 to 21. And they concluded that children and adolescents who are lonely may be as much as 3 times more likely to develop depression in the future, and that the impact of loneliness on mental health could last for at least 9 years. So even after this is all over, there's gonna be long-term effects of this pandemic affecting children and adolescents for years to come. It feels almost overwhelming just thinking about it. And yet we all have to rise up to the occasion and do whatever we can to support. So here at Boston Children's, we have continued to try to provide the same level of services despite all of the challenges that have already been described. Some of the things we've noticed at the beginning of the pandemic, there was a significant decrease in the volume of patients coming to our emergency room the first 6 weeks of the pandemic, and that has quickly reversed. We have maintained open our inpatient and residential programs. Our outpatient program has gone 100% telehealth, and we have continued to provide support to schools. The last thing I'll say about schools is that there was another study that showed that of the adolescents who receive any type of mental health services, over half of them get some portion of it at school. And close to a third receive all of it. And so when there's school disruption, there's a significant proportion of kids who are not able to access their mental health services. Thank you.
Thanks. Barry, can we turn to you now?
Yes. Hi, everybody. We knew that this was going to be challenging in a sense because we're all asked to of the mental health impact, and I think that this may be redundant. I'm going to try not to reiterate everything because I think we all have similar kind of ideas, and so far we've had 2 really beautiful presentations that have been pretty comprehensive. Actually 3, including Dr. Bromberg. I guess I'll say I think a little bit of commentary and context I can add. I'm listening to this and I'm feeling the sense of dread and nervousness, that's kind of welling up because as I started thinking about all this, it just brings back home sort of how profound the kind of risks and the challenges that we're facing, as a nation, and it really speaks to the fact that we need our defenses. That our defenses are kind of protecting us against, a lot of the full awareness of all the uncertainty that we're facing. And as the pandemic, kind of goes on, longer and longer, I think these defenses are starting to get tired, and frayed. So I think that in general is an issue, is that we're all utilizing defenses as best as we can to protect ourselves against the anxiety in the face of all the danger and the risk that we're facing, and they can only be used for so long before they start to poop out on us a little bit. And I think that we've seen that in a sense in the resurgence of presentations of patients to emergency services and crisis services. In the beginning, there was this almost like a lull that was kind of eerie in a sense, because we weren't seeing people who are vulnerable sort of presenting with mental health crises, and now it really is resurging. I skipped over my background. My name is Barry Servet, and I'm a child psychiatrist, and I'm the statewide medical director for McPath. And I have a special interest in integrated care and trauma-informed care and dissemination of evidence-based practice and things like that. So just to kind of contextualize a little bit more just about the key mental health issues that I think about, I think the first category really is the fact that basic needs of kids is really a foundation of mental health. You can't have mental health without physical health. You can't have physical health without mental health. But a lot of the basic needs of kids have been disrupted, which really provides that kind of foundation for mental health. And so I'm speaking of the increase in poverty, which is going to accelerate given the lack of funding currently for continuation of recovery oriented expenses. Food insecurity, housing insecurity, all of these kinds of issues are, they speak to the fact that the basic needs of kids are really at risk more than ever, and that's going to be a major challenge for mental health. The lack of school has been discussed. That relates a little bit to the basic needs. The fact that many kids are losing access to meals that are being provided at school. The lack of supervised interaction with peers, almost like a sort of kids they're seeing other kids online. There's too much screen time, and even outside, especially in the summer, there's a lot of informal play going on, which oftentimes, but then there's all kinds of safety issues in relation to that play, especially in communities where there is a risk of violence outside, and almost like a Lord of the Flies, kind of situation where kids are really not being supervised and being left to their own devices without sort of the role of adults and really overseeing their social interactions, and so that's concern about the loss of school, the loss of structure, which in some ways is a basic need for human beings, is pretty significant. The loss of the weekly and the daily rhythms of life, reduced language stimulation, which I think kids get at school, aside from just the educational content. And then just the exposure to physical and psychological safety risks at the home, in the home. Generalized stress in general, generalized stress is just very high, and stress has always been known to be a trigger and a risk factor for psychiatric illness. And so people have already spoken to the fact that the whole society is stressed and children are stressed as well. That there are safety concerns, kids exposure to news and to unfiltered information repetitively has been stimulating lots of concerns about safety and health for the self, and also safety about parents and grandparents and other relatives. Uncertainty about the future, who knows what's around the corner, the sort of the fabric of what we assume to be kind of just a given is all sort of thrown into question currently, because we're facing circumstances that really have not happened, in recent history. And then all the political and social turmoil has an effect of just increasing the overall levels of stress for children and their parents. And I guess, I think I'll sort of finish up with just the whole issue about buffering, that there's lots of research and understanding of the fact that, people can tolerate lots and lots of stress, but they need buffering systems in order to be able to do that. And so the buffering is a major source of that is really the integrity of relationships, both in the family, in the community, and with peers. And we're seeing an unraveling of some of those buffering effects, particularly when it comes to depression and anxiety of parents and caregivers. It's much more difficult for them to buffer the stress of children when they themselves are experiencing so much stress. And then we've already heard about the issue of loneliness, or the epidemic, if you will, of loneliness, which reflects or is an example of how we've lost some of the buffering that's provided by these relationships. And then lastly, I guess it's already been said, but the access to care challenges in the middle of all of this, that mental health systems are functioning, but they're not all functioning as well as they could be. And there are many people who have difficulty accessing the digital services that are available, and the digital services themselves are not really working for everyone. They're working for some, but not all. And then lots of systems are just in turmoil economically, and so we've seen a lot of disruption in the system of care, which is another buffering sort of influence, which is at risk and has been degraded. So I guess I'll stop there, and I'm looking forward to having discussion so that we can talk about what to do about all of this. But I'll pass it along to Pamela.
All right, thank you for having me. Well, I don't think that I'm probably going to say a whole heck of a lot more that you guys haven't already said, but I will. I just will jump into it from a social work perspective. As a social worker, I am the director of social work here at Boston Children's Hospital. We, as you know, are a tertiary care environment and a level 1 trauma center, which means that a lot of the kids that we see in social work have not necessarily found relief in their primary or secondary systems, or have a level of acuity, and they end up with us, mostly because we just don't have the abundance of social work that we would like. And so there is typically a mountain of referrals, and we end up on that top portion of being able to get to those referrals. And what we see in the outpatient side, on the inpatient units, in the emergency department, is just an increased level of restrictions. We've got kids that are restricted in movements in their homes. We've got kids that have a level of maybe that wasn't for, a level of unpredictability that wasn't there before, perhaps a level of safety concern that maybe was there before, but they had some sort of a systems buffer, which Barry was talking about, that helped to provide an element of safety. And while a caregiver might not be that emotionally available caregiver, there were other caregivers in that environment that allowed for an opportunity for levels of support. And with this pandemic, what we see is that those systems are significantly decreased. We're also seeing families that have incredible amounts of housing instability, incredible amounts of food insecurity. What we know, and this is already mentioned, that children of our Black and brown communities are at greater risk, and they are struggling, and they were struggling before, and the pandemic has not necessarily helped at all. And so we are working with those families and trying to provide levels of support. The developmental piece continues to be a concern. If you don't have those buffers, if you don't have those systems around you to provide levels of support, then you're not getting the mental stimulation and the brain development. We also know that when crisis occurs, your body is flooded with adrenaline, and so you have this body response. And so these kids are living with adrenaline in their system. We know that the half-life of adrenaline is 72 hours, and that means that it affects our autonomic nervous system. The effects of the autonomic nervous system are significant. And as it continues to go on, we continue to see kids that are dysregulated because of the presence of all of that adrenaline in their system. It's still going. When we think about healing, we think about getting to a point of a level of stability and predictability, and we're not at that place in a pandemic because it's continuing. And so healing becomes more difficult when the trauma is ongoing. And children show that within their behavior and show that within their sort of expression. Oftentimes they look to a parent or caregiver as, is this safe, or is the world okay? And if that parent or caregiver isn't able to find a level of stability for themselves because they're fearful, perhaps rightfully so, then you get kids that then demonstrate that same sort of behavior. And we're seeing that. We're seeing an increase in the emergency department. We're seeing an increase in acuity on the inpatient floors. Our primary care are seeing families that are consistently outreaching for support and asking for access to resources. And as everybody has said already, this will continue.
Thanks. Thank you, everybody. You know, I think the comments we've all made give you a very broad framework for thinking about all the various ways that the lives of the children and families that we care for have been impacted. And an important question in this is, you know, how do we differentiate the sort of normal and appropriate kind of emotional responses to the current circumstances from responses that reflect a mental health concern and a need for some sort of intervention? So I'm going to throw that question out there. I'm going to ask Barry to respond to that. How do we differentiate what's an adaptive sort of appropriate emotional response? And, you know, for those care providers in our audience, when should we start to worry?
Yeah, you know, I've thinking about that a lot lately because, you know, I'm talking to patients all the time who've been having anxiety. I have anxiety myself, and depression. You know, people are isolated. People are they're withdrawn. You know, they may meet criteria, you know, for major depression if you sort of take away the context. And so the dividing line for me has to do with kind of self-regulation. You know, that if you are having emotional symptoms and there's no kind of homeostatic sort of process, you know, that's going on, that is self-care, you know, if you will. You know, I mean, the term self-care is used, you know, a lot, but it has to do with, I think that's what I'm talking about in terms of homeostasis. So if you're not taking care of yourself and you're not able to control the things that we do have control over, and then you're in this vicious cycle of getting more and more sad or more and more anxious, then that's really a sign, you know, that you really need formal help, informal, you know, and formal. And so I, you know, the DSM-5 and all the editions of the DSM have talked about, you know, the two issues about intensity of suffering and functional impairment as the two criteria that must be met for one to consider oneself to have a, you know, diagnosable mental health problem. And so those are a given. You know, so it has to do with, you know, inability to function and the degree of suffering, you know, that's associated with these symptoms. But I think a lot about just the self-care and the kind of regulatory kind of mechanisms that people, you know, need to draw upon when they're feeling distress. And many patients with, you know, diagnosable mental health problems, that they're not able to utilize those things without some kind of help.
Thanks, Barry. Pam, do you want to respond to this question as well? Sort of where is that line between kind of a normal adaptive response and one that, you know, care providers should be concerned about?
Yeah, I mean, I guess when I think about the statement prevention is resource dependent, which is a very social work statement, right? But it's incredibly applicable. One of the things that we should assume is that in order to help people along with this, then it will take resources, and it will take an influx of new resources and a reaffirmation of old resources in an effort to prevent what we don't want to see, which is, you know, that sort of consistent instability. And so oftentimes with kids in crisis, what we're looking at is how are they sleeping, how are they eating, some of the really basic pieces of the body response in an effort to help the child have a level of stability. In community crisis response, we use the 80-20 rule, which is 80% of people will heal over a normal period of time with normal supports or with some small supplement of supports, and then 20% will develop PTSD. You know, I don't know if this pandemic is a different scene, right? And so that rule might not apply. But I do think that if we are paying attention to how we are creating levels of safety and stability, utilizing resources, upping those resources in our communities, then we offer a better chance for healing.
Thanks, Pam. I think that's, you know, you made a really important point that, you know, everything we know from the past may or may not apply. I mean, we're dealing with something that's just so different and, so, you know, on a global scale. So I think we all have to stay especially attuned to these kinds of conversations to know where we're headed. Obviously, all kids are impacted by this. And I want to ask, let me start with Patricia. Developmentally, is there an age child that you're most particularly worried about, and for what reason?
Yes, thank you. You are absolutely right in that the impacts affect kids of different ages in different ways. Let's take the impact of the lockdown, for example. For younger kids, preschool and all, being at home with their parents is an upside. It's a great thing. They have the comfort and support and the attachment. However, they are also more sensitive to changes in those parents. And if the parents are stressed, if the parents are arguing with each other, if the parents are going around disinfecting every surface in the house, those younger children are going to face and know the impact. And the way sometimes that it will manifest, I think Michelle had talked about at the beginning, is the regression in skills. And looking for things like increase in clinginess, how they're clinging to their parents, you know, a change in their potty training, you know, the wedding, increased tantruming. Those are the kinds of things we look for in the younger age group. For older kids and adolescents, the impact of the lockdown is huge. They are the ones more vulnerable to the emotional stress related to that. And there are some, sometimes they say, well, if you have siblings and other people that you're in quarantine with, that helps. And there are other studies that actually shows it helps to some point. But parents and siblings are not a replacement for peer interaction. They don't have the same patience to engage in the same level of conversations. And so those are that age range, that age population of teenagers are at highest risk for increased suicidality. And that's actually what we've been seeing here during the course of the pandemic, is that at the time when there was a significant decrease in the patients we saw in our emergency room, we were actually seeing high volumes of patients who were medically hospitalized because of suicide attempts. So they bypassed the ED, came up to the medical floors, and we had twice as many patients hospitalized on our ICUs after a suicide attempt. So the pandemic affects all age groups, but certain groups are more vulnerable than others.
Thanks, Patricia. Michelle, do you have any thoughts about that in terms of developmentally? You know, is there a certain age child or adolescent that you're most worried about?
Well, I think Patricia answered that very, very well. To add to that, I think is, you know, the kids who already were at a disadvantage developmentally. So youth who are on the autism spectrum, youth who are living in poverty, or youth who need, you know, very, very young folks who need early intervention services and aren't able to access those at the same level and same rate that they were able to before. And I mentioned earlier that window of opportunity. The conversations that I'm having with the program directors and direct care workers is that, you know, the delivery of particular services such as occupational therapy, physical therapy, you know, is really impacted because we can't go out into the homes at this point. And so we won't know for some time what those delays are, but we know that these services exist and are very effective. We know that based on the current research. And so the lack of those services inevitably will have developmental impacts moving forward, and possibly, you know, like long sustained impacts, you know, into later childhood and into adulthood if we miss those opportunities. And so that's where, you know, to build on what Dr. Ziacco, excuse me, said, is really, you know, developmentally, you know, there are going to be impacts that everybody experiences, and depending on the level of resilience, the level of ability for the family to respond or the community itself to respond, there will be certainly different levels of impact for each youth.
Thank you. Obviously, uncertainty has been a big theme over the past few months, and I think as we head toward the opening of the school year, maybe even more so. How can we help parents prepare themselves and their children for the uncertainty that lays ahead and what's going to be probably a very fluid and dynamic sort of situation? Patricia, you want to respond to that?
Sure. I think that the uncertainty itself makes it difficult to know which area to target for parents. But there are several general themes that we can help them with. One is to advise them to dial back the media. How this process is managed matters when it comes to shaping young people's feelings and their experiences about this period. We learned during 9/11 that watching the primetime coverage of airplanes flying into the World Trade Center and all of that contributed significantly to emotional distress. And when we hear about COVID-19 death rates and things over and over again, and when children and adolescents are exposed to that, that could definitely impact how they process this. We should also encourage parents to have open communication with their children and find out what they know, because there might be some misinformation. At the beginning of this pandemic, there were some resources for children saying things. I remember seeing one with a picture of a child eating a cookie with the virus on the cookie, saying you could get COVID this way. And so we don't know what children have been exposed to online. We don't know when, and it's important for parents to have an open conversation and correct them and even validate their fears. The things that we're doing to try to combat the infection are in themselves prone to making kids feeling anxious. And parents can help by reframing. And they can reframe the precautions like social distancing and wearing masks with their children as ways to behave proactively, so just to give the kids a sense of control. And they can say things like, here's what we're doing to keep our families safe and to keep others safe and to make sure healthcare workers don't have to worry about us. And the last thing I would say is it's a double-edged sword, the internet. And so on the one hand, you want to make sure that the adolescents in particular don't rely too heavily on the internet to combat feelings of loneliness. On the other hand, we should use science and technology to our advantage. We're no longer in 1918 when the Spanish flu hit. We have access to video groups, we have access to FaceTime, and research has shown that online groups can really be beneficial to help people with their sense of participation and inclusion. And so there are ways to use these resources to help kids and adolescents feel better, and parents themselves.
Thanks, Patricia. You know, a little piece of guidance I give to parents when they're talking to their children or teens about, you know, big things like this is not to assume that they know what the child's experiencing, but really to listen first and to understand what the child's questions are, or as Patricia said, you know, how accurate their information is before they respond. Another question I think that's particularly applicable to our audience today, what should pediatricians and other care providers in the medical home say to parents who have children who are not following, you know, recommended guidelines for social distancing, mask wearing? How can families sort of reduce the tension and stress internally? And I think this often comes up with teenagers, young adults. Michelle, do you have some thoughts about that?
Yes, thank you. I think to build on what was said previously, you know, first we have to acknowledge that, you know, to the parent, that it's okay for them to be experiencing the levels of anxiety and uncertainty that they are. I think oftentimes as parents, you know, they feel as though they have to kind of be the strong and the emotional support, and aren't able to share with their children that they're human too, and that that they too are a little bit nervous and scared, and we're going to get through this together. And I think also to help put it into context, so help kids understand the reasons why, you know, we're doing this. And I loved what Patricia said about reframing that, so that there's a reason for it. So we know adolescents are working towards independence. They want to differentiate and separate from the family unit, and that in itself is incredibly challenging. So what locus of control can we allow the youth to have, you know, within that context? And so what kind of face coverings do you want to wear? How do you want to, you know, set some control over your environment around scheduling? There are some structures that are in place for them for school, but I do a lot about adolescents just, you know, opting not to attend online classes, or opting not to participate or complete assignments. And you know, there's multiple reasons that happened. And I would expect and imagine that schools have had some time to put some more structure in place to support the students in that way. But allowing the adolescent, again, some locus of control, helping maintain some structure in the house, and then helping them understand why they need to do the things that they're doing, I think would be incredibly helpful. And then as a parent, you know, when you have an adolescent, it is okay to share, you know, your own fears and your own worries, but then how you're also reframing that. So modeling is incredibly important, even though we think our adolescents aren't, they absolutely are still listening and watching.
Yeah. Thanks, Michelle. Pam, do you have any additional thoughts about that question?
Yeah, I mean, I think the part that feels like the most important part for me in a lot of in finding a lot of these answers is that you don't have to do and deal with whatever is presenting by yourself, that there are resources. And while the access to resources, excuse me, feels harder to engage because we're not able to see each other face to face, the resources are still there, and you don't have to have all the answers as a parent. And asking for the support that you deserve is an incredibly important part of making it through.
Thanks. As we head toward the top of the hour, just one last question. As care providers, what should we all be sort of on the lookout for? What are the most significant sort of long-term effects that we should be really tuned into and paying attention, observing in the children, families that we're caring for? Barry, do you have a thought about that?
Yeah, I guess, you know, short term becomes long term. And so I don't necessarily see the dividing line as clearly between those issues, but I think that you just as there is more, ongoing stress on children and loss of protective factors, that I think that the concern, over the long term is just that we're going to have increased prevalence of untreated psychiatric morbidity, and potentially mortality. And I think that's a big challenge. I mean, along with all the other challenges. So I am concerned about rising rates of suicide and school dropout and school failure, and increased risks of injury and harm, to children, without the normal protective factors of school, and structure and other kind of normal kind of preventive factors that are being lost. So I think that we have to advocate as mental health providers and general health providers for resources to support fragile care delivery systems, and for resources to address the social determinants of health, which are really at significant risk in the short and long term. Jonas, you're on mute.
Patricia, do you have any sort of final thought about that question about what, as care providers, what's the what's the most significant things we should be looking for in terms of long-term effects?
I think for care providers, it's important to just screen routinely for mental health issues. And, PCPs in particular are uniquely positioned to help bridge that gap when it comes to access to mental health care. And whether it's a depression screen, anxiety screen, suicide screen, even now there is a new COVID impact screen, is something that is important to just start doing routinely for every patient that we see. And it's also important to find out if the patients and their families are from communities that have been hit harder by COVID, because they would be at higher risk of the economic impact. If there are any pre-existing mental health conditions, they are at higher risk of service disruptions and not having the resources and device connectivity. So anything that we can do to bolster them will be extremely helpful.
Thank you, Patricia. We're at the top of the hour. I want to thank all of our panelists today for making time to be part of this conversation. I want to thank the audience today for tuning in. It's remarkable, I think, in this moment. I've never experienced a point in my professional life where I'm living, the same thing that my patients are living, day to day. And I think that presents an enormous challenge, both in terms of emotional resources, and lots of other things. So I think, we're all living this along with our patients. So, we have some sort of firsthand appreciation at the same time, and hopefully less of the complications having that same sort of experience. But again, thank you everybody for participating today. I really appreciate your thoughts and insights, and thank you to the audience.
Thank you.
Thanks everybody.